RRB, Shift 3, Answer Key 2025. Controls involuntary actions such as blood pressure, salivation, and vomiting. A. Cerebellum. B. Medulla oblongata. C. Cerebrum. D. Thalamus. Answer, B. Medulla oblongata. When does the puerperium period typically begin? A. At conception. B. Immediately after delivery of the baby. C. At the start of labor. D. When the placenta is expelled. Answer, B. Immediately after delivery of the baby. What is the correct depth of palpation for deep palpation during physical assessment? A. 1 cm. B. 2 cm. C. 4 to 5 cm. D. 7 to 8 cm. Answer, C. 4 to 5 cm. The famous bronze statue, Dancing Girl, belongs to which ancient civilization? A. Mesopotamian civilization. B. Egyptian civilization. C. Chinese civilization. D. Indus Valley civilization. Answer, D. Indus Valley civilization. What is the primary use of a goniometer in a clinical setting? A. Measuring blood pressure. B. Evaluating body temperature. C. Monitoring oxygen saturation. D. Assessing joint range of motion. Answer, D. Assessing joint range of motion. What does UHID stand for in a hospital setting? A. Unified Hospital Identification Data. B. Unique Health Identification Digit. C. Unique Hospital Identity Document. D. Unique Health Identification. Answer, D. Unique Health Identification. What does LAMA refer to in healthcare settings? A. Long-term admission for medical assistance. B. Leave against medical advice. C. Loss of medical auditorium. D. Late admission medical approval. Answer, B. Leave against medical advice. Which cranial nerve is most commonly affected due to increased intracranial pressure in hydrocephalus? A. Optic nerve. 2. B. Trochlear nerve. IV. C. Abducens nerve. Vi. D. Vagus nerve. X. Answer, C. Abducens nerve. Vi. Which major arteries supply blood to the large intestine? A. Renal and splenic arteries. B. Superior and inferior mesenteric arteries. C. Celiac and hepatic arteries. D. Coronary and gastric arteries. Answer, B. Superior and inferior mesenteric arteries. What is the primary mode of transmission for salmonella infection? A. Airborne droplets. B. Fecal-oral route. C. Insect bites. D. Direct contact with infected individuals. Answer, B. Fecal-oral route. Balsalazide is primarily used to treat which of the following conditions? A. Irritable bowel syndrome. B. Ulcerative colitis. C. Peptic ulcer disease. D. Crohn's disease. Answer, B. Ulcerative colitis. Which of the following positions should a nurse instruct a patient to avoid after total ankle replacement surgery? A. Supine with foot supported in neutral position. B. Leg elevated on pillow under the calf. C. Abduction of the operated ankle. D. Use of compression stockings. Answer, C. Abduction of the operated ankle. What is the first priority in the first stage management of a snake bite? A. Apply a tourniquet above the bite site. B. Cut and suck the wound to remove venom. C. Reassure the victim and immobilize the affected limb. D. Give painkillers immediately. Answer, C. Reassure the victim and immobilize the affected limb.
In the TNM cancer staging system, what does an X indicate? A. No lymph nodes were examined. B. Lymph nodes are not involved. C. No evidence of primary tumor. D. The cancer has spread to distant organs. Answer, A. No lymph nodes were examined.
In the standard WHO partograph, which symbol is used to record maternal pulse? A. Triangle. B. Circle. C. D. Cross. Answer, C. According to Erickson, during which age range is the intimacy versus isolation stage most prominent? A. Infancy. B. Adolescence. C. Young adulthood, 18 to 40 years. D. Middle adulthood, 41 to 65 years. Answer, C. Young adulthood, 18 to 40 years. Where are the parathyroid glands located in relation to the thyroid gland? A. Inside the thyroid follicles. B. On the anterior surface of the thyroid gland. C. Embedded in the posterior surface of the thyroid gland. D. Floating freely in the neck cavity. Answer, C. Embedded in the posterior surface of the thyroid gland. What is the primary legal purpose of having a patient sign a LAMA form before leaving the hospital? A. To restrict the patient from returning. B. To deny the patient any further medical care. C. To document the patient is leaving voluntarily and understands the risk. D. To transfer the patient to another facility. Answer: C. To document the patient is leaving voluntarily and understands the risk. Which lymph nodes are primarily located near the heart and within the chest cavity? A. Cervical lymph nodes. B. Axillary lymph nodes. C. Mediastinal lymph nodes. D. Inguinal lymph nodes. Answer: C. Mediastinal lymph nodes. What does foul-smelling lochia typically indicate in a postpartum woman? A. Abnormal involuntary process. B. Onset of lactation. C. Uterine infection. D. Retained placental fragments. Answer: C. Uterine infection.
A child is on long-term nebulization therapy with bronchodilators. Which of the following side effects should the nurse closely monitor? A. Paresthesia and irritability. B. Restlessness and confusion. C. Tremors and tachycardia. D. Constipation and bradycardia. Answer: C. Tremors and tachycardia. What type of necrosis is commonly associated with severe burn injury? A. Coagulative necrosis. B. Liquefactive necrosis. C. Caseous necrosis. D. Fat necrosis. Answer: A. Coagulative necrosis.